hundreds of years, the medical profession has enjoyed status and cultural support, while mental health care, a more recent evolution of techniques to also reduce maladies, has struggled for recognition and similar cultural support. Decades of improvement in techniques have brought effective treatments for PTSD, anxiety, depression, and other concerns that reduce people's quality of life. Less cultural support for mental health care results in various marginal positions compared to medical and surgical care. These are particularly apparent in how insurance companies and government agencies make decisions regarding mental health treatment in comparison to medical health. Simply put, because of historical stigmas and privileges, the behavioral health community is less politically powerful than associations of hospitals, doctors, and their patients, and therefore, when cuts are needed, behavioral health looks like an easier target. The Parity movement has focused on bringing emotional health and the treatment of mental disorders into parity with the medical and surgical fields, and has made recent strides in legislation both federally and in Colorado. The core concept established in law requires that processes that determine treatment limitations are similar between the behavioral health policies and medical policies when a payer covers both. Treatment is limited in order to contain costs. Who sets limits on treatment? Insurance companies for commercial insurance, federal and state agencies for public insurance, and the for-profit and non-profit contracted managers of public insurance. How is treatment limited? At enrollment through pre-existing conditions, then through diagnoses, medical necessity, provider qualifications, contracting, covered services, reimbursement, and prior authorizations, for example. Participation in insurance programs can be limited, such as by evidence of a pre-existing condition. A person may not be able to get insurance or enroll in coverage based on some rules. Parity requires that these rules be similar for inclusion in a medical program as for inclusion in behavioral health coverage. Once a person has coverage, treatment is limited by covered diagnoses. Payers have developed lists of maladies that are covered and not covered. Typically, a mental health challenge must be described in the DSM-5 to be considered for coverage. The bureaucratic processes that evaluate a diagnosis for inclusion in coverage need to be similar. If a person has a concern that is covered, treatment can be limited by medical necessity. Payers require that a treatment be medically necessary for coverage. Various assessments can be made about acuity or severity. Sometimes people are required to participate in a lower level of care called step therapy before accessing more acute care. Whatever procedures are used to make these determinations need to be similar between medical and behavioral health. Inadequate access to treatment limits treatment. Access first requires providers. Decisions about who is qualified to serve must follow similar processes for medical and mental health. Once qualified, providers participate in credentialing and contracting. When these processes are arduous, complicated, and months in duration, providers are dissuaded from participating. However the process is managed, it violates parity if the processes are not similar. Medical providers and mental health care providers bill for approved treatments. The processes that govern which codes are billable must be similar between medical and mental health care. Currently, medical can bill codes that mental health can't, even when conditions are similar, such as extended encounter codes. Reimbursement rates that are too low will limit the number of providers. When reimbursement rates are set in ways that produce an adequate medical network and an inadequate behavioral health network, parity law is violated. Policymakers are obliged to use similar processes for determining reimbursement rates for behavioral health and medical treatment. Once treatment is determined to be medically necessary, treatment can be limited by prior authorizations. Requiring prior authorizations for treatments is understandable. The law requires that the processes for setting prior authorization policy is similar. These are a few examples. Parity is the law and compliance is not a done deal. The society needs the payers and regulators to stand for the law and make parity a reality.